My name is Patsy Meyer. I live in Dallas, very near the medical school in Parkland, because I came back for the services offered by the medical school for my husband, and then I've stayed down here where all the young people, the happening places, I tell my kids. And we've always been connected with the Parkland. There used to be something called the Parkland Society that was the surgeons who had graduated through the old system. When you came to UT Southwestern in the 70s, you said you were going to Parkland because that was the primary clinical service area. In fact, Presbyterian was a new service when Don came. So you expected to be spending almost all your time at Parkland, and you learned the different services, and that's where, in the surgery. And so when they graduated, they called themselves Parkland grads. And so we have always been associated with that. He and some of his partners, his graduating colleagues, were some of the first ones. And they were on the shoulders of the people that were the giants, Dr. Mack, Dr. McClellan, and Dr. Shires, and all the saints that have gone before them in the surgery world. Dr. Laycock, their names just still bring a tear to my eye. They were so fine. And they were my husband and his colleagues' mentors. I came back here. I was involved in community development in El Paso, and we were very involved in different programs. And when we came back to Dallas, I was Dom's full-time caregiver until he progressed to the hospice stage, and then he was in a residential hospice home, but I would go every day and feed him lunch. But I didn't volunteer until after he was gone, when I wasn't caring for him. So I started officially volunteering in 23. We used to say, you know, if you can care for a child, you get more money if you pull those heartstrings than the poor old indigent, homeless, or unhoused person. And yet all needs are equal. We believe that all needs should be addressed as best as possible. Therefore, we sent our money into the general pot that will meet the need that was rising to the top at that time, which, you know, supports the workers who work here, because they need to be paid well as well as anybody else. So that's why we put it into the general fund. I do encourage people to give as they are able, and it doesn't have to be a huge amount that will put your name on the building, but give as you are able to do so.